Hi, friends, and welcome to the Autoimmune Mom Podcast. I'm your host, Allie. This is a space for moms navigating life with autoimmune disease, the exhaustion, the guilt, the strength it takes to show up, and the hope that we can still live full, meaningful lives even when our bodies make things harder. Each week, we'll have honest conversations with moms living with autoimmune disease, share practical support, and remind each other we are not alone in this journey. Before we dive in, if this podcast resonates with you, it would mean so much to me if you would follow or subscribe wherever you're listening, leave a review, and share this episode with another mom who needs it. You can also connect with me on Instagram, Facebook, and YouTube at the Autoimmune Mom Podcast, where I share encouragement, resources, updates about new episodes. If you're looking for extra support, you can download my free Autoimmune Mom Survival Guide through the link in my bio. Let's get into today's episode. I know, great. Hi, Amber. Welcome to the show. Thank you so much for being here. I'm going to start a little different and ask you to just give us a little bit of a introduction into yourself.
Sure. I'll try to make it short. I'm a podcaster as well. So I am one with the yap. So my name is Amber Tresca. I am the founder of About IBD. I was diagnosed with ulcerative colitis, which is a form of inflammatory bowel disease in the long ago of 1989 when I was 16 years old. I had J-pouch surgery, which is a surgery where your colon is removed and then they take part of your small intestine and create an artificial rectum out of it. So I had that surgery in 1999. And because we're going to talk about some mom stuff today, I became a mom in 2007 and 2010. And I am primarily a writer and editor and mostly do the About IBD podcast to yap and have fun and meet cool new people like yourself. So that was the nutshell.
I love it. I love it. I love the yapping part because that's pretty much what we do here, right? We're just yapping. So 1999, that's a long time to be living with IBD.
Yeah.
And I'm curious to know well, let's talk about early diagnosis because you were young.
Yeah.
16 years old.
Yeah.
So this is well before parenthood, well before, I mean, you're like in high school and having to deal with
like a
this
baby.
is a pretty serious disease to be dealing with at such a young age. So if you could give us a little perspective on that and your early journey and what that looks like.
Yeah, I'll do my best. Sometimes it's hard without like throwing people under the bus. Because as you get older, you realize how messed up things were when you were younger.
Well, I would assume that they have changed a lot in the medical world between 1989 and how you are diagnosed today.
100%. Like it's come so far that I can't even contextualize it really specifically. But I was 16. The diagnosis came after an initial misdiagnosis. I ended up in the emergency department because I was having bloody stools. At 16, I wasn't really tracking my weight. We didn't do that at that time. Maybe when you went to the doctors, but that was about it. And as a teen, we didn't really do that at that time. So I was probably losing weight at that time and experiencing left-sided pain, which is common with ulcerative colitis. Ended up in the emergency department where they misdiagnosed me with some BS. I think they said intestinal flu, which is like, that's not a thing. That's not a thing. So they sent me home with like some antibiotics and things like that. And
boy,
that held off some symptoms for a little while, which I understand now why that was the case, but it didn't really address what was going on. So struggled along for a little while longer, lost a lot more weight, got to the point where it was 20 bloody stools a day at least. And pretty much bed, bathroom, bed, bathroom, bed, bathroom. That was it. And I saw my pediatrician, who then referred me to a gastroenterologist, an adult gastroenterologist. I'm sure there were pediatric gastroenterologists at the time. Didn't know any. So that was what we did. And it was going to take too long to get in to see them, which is something that everybody will recognize as a new patient. And it was my mother on the phone. This is core memory time. It was my mother calling and saying, no, she needs to come in today. She needs to have this colonoscopy today. That she's not in school. this is not okay. We're just going to end up in the emergency room again. So didn't end up with the doctor that was originally going to take my case, ended up with a much younger physician, a baby doc. And, but he diagnosed me right away. So wheeled me out of the colonoscopy, room and then into the recovery room, right? Came in to see me. You have ulcerative colitis. Inside of your colon looks like raw hamburger. Didn't leave the hospital for 40 days after that.
God.
So it took that long to reverse the course and how diseased my colon was at that time. Came within a hair's breadth of a colectomy then. Just narrowly escaped it. And in those days, I was living outside of Detroit. They were going to put me in an ambulance and send me down to the Cleveland Clinic because that was a specialty center. Thankfully, or not, I don't know. Maybe it would have been better to have it done at that time, but was able to get things under control medically. Took a long time recovering, getting back to school, etc. Had another major flare up the next year. Went through pretty much that whole situation again. And by the time my senior year came along, I was like, don't even put me in the hospital. I was like, just give me like lots of steroids and I'm just going to like power through it. And that's what I did so that I could graduate high school and go to my senior prom and all of that. And if you know,
be a little bit normal.
I mean, it's so funny because at 16, like you don't even know you know what's normal for the past year, past 6 months, past month, but you don't know what a normal life is. You don't know what a normal healthy life is.
Yeah.
And so this is such a change before you have even established and your frontal lobe isn't developed and you don't even know anything about anything. So yeah, it's really wild. And plus, peers don't understand, and no shade to they're just not going to. It's just impossible. So, and peers don't understand, teachers don't understand, professors don't get it, nobody got it. So it was a lot of struggle and power through until I became an adult and found my voice. No pun intended.
Well, I don't even think 45-year-old women understand until you've walked in someone else's shoes. You can't. There's no way you can understand.
100%.
There's just no explaining what these diseases do to people until you've actually lived with it yourself or a loved one you live in the same house with. You can see it happening too. I don't believe, even my own siblings, they see me suffer sometimes, but they don't see the everyday in and out of it. And so I think that's important for people to remember that they don't know because they don't know, and they're lucky they don't know. But it doesn't make it any easier for any of us.
No, it sure doesn't. I mean, I don't ever want anybody to join the club. Like for sure, no. Like that's always my first thing. I'm so sorry that you're in the club.
Yeah.
But now we understand each other in a way that other people are not going to understand you. Unfortunately, the healthies, as I call them.
The healthies, I like that.
The healthies, yeah.
Okay, I interrupted you. So where were we? Steroids through high school.
Yep, got through high school. In those days, I had 2 treatments available to me, and they just eventually stopped working. So I struggled through until I was 26. And also in those days, this is before the Affordable Care Act. So I did not have insurance. I went for a time without health insurance because I did not have employment that would offer it to me, and I was unmarried, and you could not stay on your parents' insurance in those days. So I was paying for my medication out of pocket, maybe seeing a doctor when I could. That's no way to be. Don't be like me. And when I did finally get my own insurance and all of that, established care with a new gastro, and he was like, well, first thing we got to do is a colonoscopy. And I was like, yep, you're totally right.
Yeah.
So he went and looked, and it was bad. It was real bad. I was 26, so I've been living with this for 10 years. And another core memory, I'll never forget the look on his face. He was a white guy, but he turned like even whiter when he came back to talk to me after my colonoscopy. And you're loopy and whatever, but I remember this. And he was like, I'm not sure that you don't have cancer.
my
So we're going to run some blood work. We're going to do some stuff, and we're going to do it like right now, before you leave, or at least within the next day or so. My memory's a little hazy because, they give you that twilight sleep. In those days, it was
Yeah.
twilight sleep. It wasn't propofol. So turned out I didn't have cancer, but I had dysplasia, which is the changes in the cells that are the precursor to cancer. So, and he was like, also, your colon is full of polyps. And they're probably inflammatory polyps. But again, 1999, we didn't really have, I certainly didn't have the knowledge, and I don't really know what was there, what was understood at the time. So I had all of these, what they call pseudo polyps, I believe, in my colon. And he was like, it's got to come out. There's just no two ways about it. So I remember doing a lot of crying.
Yeah.
Drugged, tired, hungry, dehydrated, doing a lot of crying. But it worked out well. I went and got a couple of opinions from different surgeons. And this is a point where I was like, do be like me. Do be like me. Go and find a couple of different surgeons to talk to and get opinions. They had vastly different ways of proceeding. And so I went with the one that most aligned with me. And I would say it is probably one of top 5 best choices that I've ever made in my life. I was in the right place at the right time. So I had my J pouch surgery, which I think I talked about it like briefly. One thing about yapping is that sometimes you forget you're yapping, is that they remove your entire colon and, in my case, most of my rectum. So rectum's where your stool is held.
Yeah.
So, and they do that, and then they place a temporary ileostomy where you have a stoma. So they take a small piece of your small intestine and bring it through your abdomen, and then you wear an appliance over that to catch your stool. So I had that for 3 months. And what they did with the very end of my small intestine is that they created something that's called a J pouch because it's in the shape of a J. And so they sort of, it's amazing, right? It's fantastic.
Yeah.
So they sort of fold it back on itself to create a J and staple it together or stitch it together, however it's done. People do it different. Surgeons do it differently. And then they sort of attach like the bottom of the J. If you think about a J, the bottom of it gets attached to either your anus or what's left, in my case, what's left of my rectum, that little bit of my rectum that's left. And then, so that J, it then becomes like a rectum, so it can hold a little bit of stool so that you can have a little time in between bowel movements. So it's held in there until you're ready to go.
Yeah.
So 3 months after I had that initial surgery, I had what they call reversal. So they sewed up the stoma, put my intestines back inside my body, and then you're going to the bathroom out of your bottom again. It is not like having a colon. It is very, very different than that. But it means that you don't need that external appliance. So that's how I live today. That's what I've got going on today is the J pouch
And you've had that since 1999.
since 1999. So I think, has it been half my life? Yeah, it's now been half my life I've lived with a J pouch. Yeah.
So does it feel normal to you now, or does it still feel different?
Yeah, like J pouch is normal. So for
Yeah.
me now, so sometimes I have to, if I'm being asked questions, like if I'm at the gastro and they're asking questions, I always have to be like, well, there's normal for somebody that hasn't had these surgeries, and then there's my normal.
Yeah.
So like, what are we talking about, and how do we contextualize it? So, like they'll ask me like, how many times you go to the bathroom? And which is a very common question for anybody living with inflammatory bowel disease, ulcerative colitis or Crohn's disease or other forms, because that's kind of a measure of how well you're doing sometimes. And for me, it's like, I don't know. I don't count. I don't want to think about it all the time. I don't want to make hash marks on a piece of paper
Yeah.
or put it into an app or whatever. I'm like, if it gets bad, I'll know and I'll let you know.
Right.
But other than that, I'm not tracking that kind of stuff.
It's similar for me because I've had this for 17 years now, so not half my life, but we're easing our way up there. Uh, we when I moved here, I had a new rheumatologist, and she's like, "Well, how you doing?" I'm like, "I guess I'm okay. Like, I'm flaring, but not terrible." And she's like, well, that's not really okay. I'm like, my hands hurt every now and then, and my feet hurt all the time, but I can walk, I can go, I
Yep.
can do this. So it's like my normal, and different doctors have different normals too, I think. Like, where do they
Mhm.
want their patients to live?
Mhm.
And what, you know, other people's normal who live with rheumatoid arthritis. It's just, I completely understand what you're saying. It's vastly different from patient to patient and doctor to doctor, what they are willing to let you live with, and it changes by the doctor. Um, so interesting that you have the
Yeah.
same experience.
Yeah, I mean, it's insidious also, right?
Yeah.
It's not usually, and from what I understand from, the condition that you're living with is that it can be you wake up and feel really bad one day, but like with IBD, it it can be more subtle. So all of a sudden over the course of weeks or a month or something like that, you go, "Oh gosh, wait a minute." And it's usually somebody who is close to you that will be like, "Hey, you look like you may have, lost a few pounds, or your color
Yeah.
looks bad, or, I noticed you're in the bathroom a lot more than you were before." Like that's usually the type of thing that happens because it's like it comes on so
You just
slowly and
get so used to it. You're
get
used to the
so
symptom,
used to it.
and
Yeah.
it's normal, and yeah,
Yeah.
that must
Which
be
we
difficult.
shouldn't accept that. Like, by the way, I'm just gonna put that out there.
Yeah.
Especially, I mean, I can only maybe speak to IBD, but we had the therapeutic landscape is so big now. Like there's so many drugs available and so many also complementary therapies, things like that. Like we shouldn't accept it. Like we shouldn't accept anything except remission. And if you're not there, it means that you just got to keep
Keep going. I
moving,
think
keep
that's part
going.
of the problem, is that you don't feel good, you don't have a ton of energy, and to, like, keep going to the doctor and labs and testing and sometimes I'm just like, "I'm done. I'm done with you people. I need a break. I have doctor and test fatigue, and I just can't do it anymore." That's kinda where I am right now. I'm like, "I need a break." But I know if I take a break too long, the damage that gets done in that little span of
Right.
time is irreversible, and so then I have to have hard conversations with myself about, "Suck it up, Sally. Get your ass back to the doctor. This is your life," you know?
Yeah. Yeah.
Um,
For sure.
so, yeah, it's hard. It's not easy. Let's talk about motherhood, because now you've had the J pouch surgery,
Yep.
and,
Yep.
uh, did you plan your babies? Were they, like, um when I say did you plan your babies, I mean, did you talk to your doctors extensively with IBD and, uh, geez, I can't think of the name, OBGYN?
Hmm.
What did that look like? Because there are a lot of people in this community who are trying to be mothers for the either
Right.
again after diagnosis, they didn't have the diagnosis for the first, child, and
Hmm.
now they do, or very early finding us and wanting a family and are nervous because of their diagnosis and don't know what to do.
Yeah. Yeah. So through my work, I actually get to talk to a lot of different gastroenterologists. So one of the questions that I asked of a gastro, her name is Jill Guidos, and she's at Yale here in Connecticut. And I said, how do you contextualize this for women that want to become pregnant and live with an IBD? What do you tell them about that journey? How do you treat them? And she was like, "Well, we don't treat them any different." She's like, because having IBD does not put you at high risk. It doesn't automatically mean that you're a high risk pregnancy. What's completely different, and going back to what we were talking about earlier in regards to how things have changed over the course of my lifetime of living with this disease. When I was asking questions at 16 and 17 about when I want to become a mother, what's going to happen, they were a little bit like, "Whoa, hey, oh," like there wasn't good answers. And one of the answers was, "We'll probably take you off your drugs," which wrong answer. That was what we knew at the time, not what is done today. But my children, yes, were extensively planned. And it's another point in my journey where I will say, be like me, talk to everybody because you're going to have to. Because the thing about IBD is that the most important thing, and maybe, lots of other autoimmune and immune mediated conditions, is that keeping that inflammation under control.
Mhm.
If you're inflamed It's not going to be good for you. It's not going to be good for a baby. It's not going to be
Mhm.
good for even trying to get pregnant. So women with IBD don't have any trouble getting pregnant, usually when they're in remission. And pregnancies usually, you know, can go well in remission, but you got to get there. So, luckily for me, I was in surgical remission at the time of my pregnancies. Now, I came out of remission and had to do a lot of things and go back on medications and so forth a few years ago in 2018. But at the time, it was more about how are we going to manage the pregnancy? Does anything need to be done slightly differently because of the J pouch in the previous series? So the biggest question was method of delivery.
Delivery, yeah.
Um, at the time, we know a little bit more now, but at the time, we made the decision to go for vaginal birth and just like just like anybody else, just like the healthies. And that was important to me. That was an important thing that I wanted to do. And so that's what we did. So I was able to have two vaginal births with my kids. And anyone who lives with a J pouch will say, well, then how is your J pouch now? It's exactly the same. There was no problem.
No issues.
No issues. I did tear. I had I think a third degree tear with my first. And I don't remember what it was with my second, because that baby was a lot smaller. But they sewed me up and I went about my business and everything has been fine. Now, I
Nice.
had extra monitoring during the pregnancies. So there were more ultrasounds, there was more touch points, things like that. And my colorectal surgeon and my OBGYN, they knew each other because same town.
Mhm.
So they would talk about me, stuff like that. So I was very, very well cared for. I know not everybody has that. But to get back to the original question, yes, very planned conceptions, very planned everything, even though we didn't really know what to do. Like there's no guidelines. There's
Yeah.
really, J pouches are actually rare. So I was also constantly explaining things to everybody. And
Which is like, you should get paid for that. Like, it's
I
exhausting.
mean,
I
it's
mean,
like,
tell Yeah.
it's like sometimes I say like I should have a card made up, but just hand
Yes.
it. Because sometimes they show up and it's not their fault. It's rare. J pouches are rare, but I show up to places and they'll be like, okay, well, did you bring a change of appliance so that you because they confuse it with an ostomy, things like that, or they just don't understand what it means and how my anatomy is differently.
So
I had
you're talking about doctors right now. Doctors don't know the difference.
doctors and nurses.
Yeah.
Yeah. Yeah. And, various, people in the
Medical.
in that circle of care
Yeah.
that surround those folks. It's better known now. The one of the times I had, so I don't have a colonoscopy, right? It's really a pouchoscopy. I don't have colon. Um, a lot of things are the same, but some things are different. And one of my pouchoscopies, I think it was the first or the second with a newer, it's like, my third set of doctors. I got the paperwork that they make you sign, they don't make you. You can choose not to, but the paperwork that they give you to sign, and it read pouchoscopy. It said pouchoscopy on it. And
Oh, wow.
again, prepping, you're dehydrated, you're tired, all of this, crying. Again, I'm crying. And people, I'm sounding like I'm a crier. I'm not a crier.
No.
I'm crying. And my endoscopist comes into the endoscopy suite and he looks at me and he was like, what's the matter with you? Why are you crying? Very funny. Like, this is totally fine with me. And I was like, because the paperwork said pouchoscopy and I feel seen. And he was like, well, you don't have colon anymore. Of course, like it was so funny. He was so matter of fact. But for me to have been living 20, 30 years, always having to
Holy,
explain myself, like it was huge. It
it
was
was a
so
moment.
huge. It was a moment, core
Yeah.
memory, and also speaks to how things have moved along. Now, do the nurses know what's going on? Not
No.
usually, no.
Yeah.
But poor
Well, they
things.
probably don't see many a year,
No, which is wild to me because I'm like, if you work in endoscopy, how can you not see JPEGs, but I guess it just is that uncommon, and my brain doesn't want to go here, that people with J pouches are not having surveillance pouchoscopies, which they should be having them. Two sides to that, they're doing well enough that they're going about their life, not being worried about going to the doctor. But also, you do have to monitor it because things can be going on and you're not aware that it's happening, and that the biggest risk, it's a small risk, 1 to 2% chance, but there is still a risk of developing cancer. So you do gotta get your, regular peaks in order to make
Is
sure that's
there
not
a risk
happening.
of it failing too? And then you would you be able to have the surgery again to replace it, or is it a one and done type of?
I think it really depends. And so the failure rate is not high. The failure rate is different depending on, it's individual, right? It's individual. And then it also depends on where you have your J pouch surgery done. My surgeon, I was his sixth J pouch, which is wild, wild. But he trained under the physician that developed the procedure. So yeah, so I was good. But there are surgeons that do hundreds. I don't know if it's thousands. I don't know, but they do a lot more than them. So they're going to know more about what to do. So if it fails, it's not common, but it can happen. If it fails, you could have it removed, go back to an ostomy. Or some people will have a revision. So they might go in, they might have to remove or restructure, do something like that with the pouch, because there's all sorts of little weird things that can happen. It can get a kink in it, and
Yeah,
things
twisted
like
or
that
something?
get
Yeah.
twisted, and things like that can happen, and people need a touch up. Not that it's a small surgery, it's not. But yeah, failure's a possibility. There's no guarantees with it. You can also develop lots of different conditions that are specific to the J pouch. So
Okay.
this is a whole other thing. There's a condition that's called pouchitis, which there's several different forms of it, but it's usually treated with antibiotics, which again sounds wild, but
Yeah. Itis. I'm in the world of itises, so
yeah,
that's sounds
yeah. Or you could develop Crohn's disease of the pouch. So that
gosh.
happens. And then you could manage it, or maybe it gets bad enough that the pouch needs to be removed. You could develop the other things that go along with IBD, like fistula, which is an abnormal tunnel between two organs or between an organ and your skin. So stool could be in places that it shouldn't be, and things like that. So all different sorts of things can happen. Again, those are not common except for
This is
pouchitis.
why you go and get screened.
This is why you go and get screened, and why I will tell you, in 1999, when I was having the surgery, my gastroenterologist shook my hand and said, "Amazing. Nice knowing you. Have a good life." Because that's at the time,
Yeah.
you know?
Yeah.
But now we know. Don't break up with anybody. Don't break up with anybody. Even if you're
Nope.
doing well, go and see them once a year, even if it's just a high five and how you
Yes.
doing? How's your kids? What'd you do on vacation? Even if it's just that. Because I had to reestablish care again for the fourth time. And that was a delay that I really,
Couldn't
it
afford.
couldn't afford it.
Yeah.
Yeah.
I'm in the situation right now where my insurance has decided not to cover my treatments anymore, and they will
Nice.
cover the treatment, but my doctor's office doesn't. It's an infusion I get once a month. The doctor's office doesn't do it the way that they'll cover it, so I'd have to find another rheumatologist if I wanna stick with this insurance, and, um or I just need to find another insurance that doesn't cost $4,000 a month. That will
Mm-hmm.
it's just finding a new physician is not an option for me.
Mm-hmm.
I'm like, "No, I've had this one for 7 years. It's a pain in the neck. It takes a year. I can't be without medications for that long." And no, it's not an option.
Yeah.
We work around it.
Yeah, and that's come up so many times in my life, and I hear from patients all of the time about these
Yeah.
things. And this is another aspect of some of the things that I do is speak with the offices of my congressional representatives whenever I can. Locally, sometimes too, it can be worth it Connecticut, I don't know about every state, but Connecticut has like an insurance commissioner that you can ask for an external appeal, that type of thing. But one of the things I do is I work with different patient advocacy groups, and we travel down to DC. Since I'm in Connecticut, it's a nice 4-hour train ride, Amtrak.
Yeah.
Love it. It's fantastic. I get the quiet car, get a lot of work done. And then I go down there and meet with those folks and talk to them about how we need reform for these things that insurance foists upon us so that they can save a penny. I mean, seriously, they're not,
Really?
it's like, come on now. And then also sometimes it doesn't make any sense. Sorry, I'm a little triggered. So,
No,
but
I'm triggered too. Let's go. See, this is what I'm saying.
I think this discussion can be valuable for folks to understand if they're interested in, if they've been subjected to these things, which everyone has in one form or another. For myself, it was an initial delay in treatment. So I was very sick and unable to receive the biologic that me and my team of 6 very well-educated physicians decided that I should go on. My insurance wanted me to try something else first. And I was like, nope, not going to happen. So it took a while to get that resolved. Most recently, I was switched from the biologic that I'm on to a biosimilar. It has worked out fine, but that didn't mean I didn't spend a couple of months like, anxiety ridden and
Right.
like very like scanning my body constantly, wondering, am I losing response? This type of thing. So it's not great. So these are the stories that I take down to DC when I go down there, and that we champion certain bills, whatever's on the table in Congress at the moment. Sometimes they change from year to year. I will say that probably not a lot is going to happen right now, but we keep doing it.
Yeah.
And one of them is to get quicker responses for these types of things, like denials, so that they don't deny, and that they don't deny like for no reason. What happened in my case, which is called non-medical switching. There was no reason to switch me except that maybe the biosimilar is cheaper. I don't know. All I know is
I
that
don't care.
I'm paying the same amount every month. The money that I paid every month for my biologic, that was the innovative product, the original product, is the same that I'm paying for the biosimilar. So how does this change my life, except for putting me through like the rigmarole of the whole deal?
To save somebody a buck.
To save somebody, I don't know who, because that ain't me.
This is what happened to me. I've been on the same treatment for 4 years, and first year, like year and a half, that I've had this insurance for almost 2 years, and for a year and a half they covered it. Well, they said they covered it. Monthly pre-approvals, full year approval, monthly pre-approvals, and then my rheumatologist calls and said they haven't paid us since June of 2025, and they're not covering anything for you anymore.
My gosh.
So I have a $82,000 balance at the rheumatologist because they're like $9,000 a month.
Yeah.
And haven't paid in a year. And my rheumatologist is like, this is business to business end. It's not on you, it's on them. So you're not gonna have to pay it, which is fine. But it does now. Here I am 3 months without treatment because I'm trying to figure out the best course of action for me to do, and not just jump into the next insurance plan that's going to do the same thing for me. So like, it's a lot of work. It's a lot of work and frustration. Why?
I'm so sorry that is happening to you. And
Thank
yet
you.
here you are, like podcasting, like, seriously, like the very definition of pushing through. Like, oh my gosh.
I'm an Irish Catholic. That's what we do. We just push through. We grin and bear it.
Yeah. I mean, you shouldn't have to.
I know.
Like, end of the day, that shouldn't happen. And besides that, I know what they said to you regarding this is not your bill to pay, etc. And that happened to me one time as well. And the nurse called me and we talked about it for a minute, and it was only like a $10,000 bill. I said, oh yeah, they sent me a bill. I said, I'm not paying it, right? I'm like, I'm not paying one single cent on this.
Not one blood penny is coming out of me. I'm okay for this.
Absolutely not. And like, it was so funny because we just laughed and laughed. And it was just like, but I know not everybody has that, can do that.
Well,
like,
no, most
having
people
that hang over your head is very upsetting.
Or how about an elderly person who's on a fixed income who might be taking these medications too? Because
Yeah.
I sit next to them every month when they're getting infused with this stuff,
100%.
and they're confused and they don't know, and
No.
they don't have the energy to fight like I do. Like, good luck trying to get that from me. 'Cause I'm not giving it. It's just you don't think about that, but there's a lot of people who are really will just like maybe they have the money and they pay it. Which is wild. Or
I can't
you
imagine.
know, I can't either, but, like, I can see where an elderly person would be like, "Well, I don't want my son to have to pay this if I pass
Yes, I
away,"
just
and
want
then
it
they
to go
pay it.
away.
I just want it
Yes.
to go
Mhm.
away, and
Mhm.
it's I think insurance is the biggest scam on American people ever run,
Completely. Completely.
period. Like,
How old are your kids? Are they driving yet?
no. But we're getting there. You can drive at 15 in South Carolina. My daughter's
Nice.
14, so
Nice.
she'll a year from in January, she can get her permit, so,
Yeah.
um,
Yeah.
yeah.
That insurance, absolutely wild. Absolutely wild when you have a new driver in the house. And I recognize that it's different in different places, but where I live in southwestern Connecticut, the amount that they want to charge is it's obscene. It's an
Yeah.
obscene amount of money for people that like I just had to get a new car. So I traded in my car that was 15 years old and they ran the VIN on it and they were like, it's never been in an accident. Wow. And I was like, yes. And yet insurance does not care.
No, they
Like
don't
it's
care.
the biggest, yeah, it's really something else. And it's not going to change tomorrow or next week or next year. But you know, if patients want to get involved in that kind of work
Well,
and
that's
trying
what
to
it's gonna
reform
have
health
to take.
insurance,
Yeah.
yes.
It's gonna have to take people being, like, opting I know a lot of people who are just opting out of health insurance right now because it's so
In some cases, it might make
and
financial sense.
yeah, not for people who like you and I, we
No,
can't do that.
no.
But for, healthy Joe down the street and his family, just pay
Uh,
cash pay everywhere you go,
yes.
and you will
Yeah.
be saving we paid $17,000 out of pocket last year for this insurance that didn't cover one of my treatments.
Yeah.
17 grand.
Right. Which is not working out for you. I know. I don't even like I'm very fortunate. I'm self-employed, but I don't go through the exchange. My husband has insurance through his company and I'm on it. But also I think it was only a few years ago that I thought to myself, this is absolutely insane that
Yeah.
my health insurance is contingent upon my relationship status.
Yeah.
That doesn't make any kind of sense.
No.
So it's not right. The way that we do things here in the United States is I could go on about it all day because it's a huge part of my work in trying to get things
Yeah.
changed and we've come far. I remember what it was like before, the ACA, and that was bad. That was real bad. It's better now, but now it's time to move it along and do things so that people
Yeah.
don't aren't like refused medications that's working for them for a long time, and then also being off of your medication, depending on what it is, you go to get back on it, you could develop
Yeah. It doesn't
antibodies.
work. Yeah, it doesn't
It
work.
doesn't work. Yeah,
Yeah. I know. That is something that I'm
can't.
concerned about.
I can't.
I know. Anywho, I didn't expect to talk about insurance again. It's like it's really a problem for me right now, so, like, it tends to come up a lot, but,
Yeah, well, I think it's important. I mean, it's a huge problem for you right now. Like, let's not
yeah,
downplay this. Like, this is a
yeah,
huge problem for you right now that needs to get solved. And not to scare patients, but people need to be aware that it's happening. And at least, I know that clinicians and industry and other folks listen to my podcasts. So you really don't know who this is going to reach. So it's important that people understand it no matter where they are in that circle of care. And I guess we have to include payers in that.
yeah,
It's important that everybody know what we're going through and that it is not just business as usual for us all of the time simply because we have commercial insurance. It's just not.
yeah. It's not. Actually, Massachusetts was much better. I we had the health insurance in
I
Massachusetts
was
was
going to say,
a 1,000 times better than it is in South Carolina, and the laws are different here, and,
yeah,
like, there's many things that we love about here, but I have to say insurance has not been good,
yeah,
and,
yeah.
I
Would
don't
you
know.
move back? Would you consider?
No, I could never move back. I
Yeah.
mean, my whole family's up there. I've got like 40 cousins and
Yeah.
800 second cousins, and
Yeah.
everybody's
Yeah.
within 12 miles of each other up there. Um, but the winters were killing me. I had no quality of life
Yeah.
from October to May or June, really. It was
Yeah.
on the couch 3 or 4 days a week. I was so
Right.
miserable.
Mm-hmm.
So it was
Mm-hmm.
a traumatic decision to leave,
Yeah.
to say the least. I had two
Yeah.
little ones, and my sisters and brothers had babies like the same age as mine, and we were
Oh, it's
all
so hard.
leaving
Yeah.
there, living together. Well,
Mm-hmm.
living in the Northeast.
Yeah.
Um, but I do think it probably added years to my life by moving. Like,
Yeah.
I'm so much healthier here than I was there. The sun
And
and I are best friends.
and this is a critical part of your journey as well, that probably you're just like, well, that's what we had to do. But I mean, let's think about it at its core for a second. Like, you had to move away from your support structure for your health.
Mhm.
Like,
I did, yeah.
that's wild. That's
It is.
wild.
I know. I could my kids we've been here 7 years this week, actually. So, my daughter's 14. So, she was 7, my youngest was 6. They're
Yeah.
14 months apart. I couldn't have done it when they were babies because I was in such flaring. The rheumatoid was so out of control. Um, and I was in one doctor to the next, like just going. And so my mother was helping me so much with my babies that I couldn't have left then. So it was a strategic time in which we talked about it for a couple years, and things got easier. They got more self sufficient, and yeah, then we just made the decision that moving would be the better option for me, and give it a
Mm-hmm.
shot. If it doesn't work, you can always move back.
Sure.
Um,
Yeah.
so,
Yeah.
but it's been life changing for
Yeah.
me.
Why did you choose though? Like, what, like, could you have moved anywhere that it was warm, or
We
what?
could have moved anywhere. My husband's in construction. He does commercial construction. So actually, like
Nice.
Arizona probably would have been better. Like
Yeah. Yeah.
drier heat is good for
Yeah.
rheumatoid. But I wanted to be. I'm an ocean girl, so I needed to be somewhere close to the ocean.
Mm-hmm.
Uh, and I wanted to be a quick, direct flight home in case I needed
Got
to
it.
get back up
Yep.
there. So Logan to
Yep.
Charleston is a 2-hour flight, and
Yep.
I can be home in 4 hours if
If
need be.
need be. Mm-hmm.
So that was a big thing, and we didn't wanna go to Florida, but we wanted someplace that maybe had a little seasonal change. Because after 100 days of 95 degrees, it's nice to cool it down for a bit, and I can handle that, but really, January and February, I'm not happy. My body I'm in real estate too, and I tend to dip. That's a slow time of the year anyway, but, like,
Sure.
I don't have it in me in the colder
To
months,
push.
and it's only
Mm-hmm.
6, 7, 8 weeks here. It's not very long.
Mm-hmm. Mm-hmm.
So,
How
yeah.
much of a seasonal? Because I think about that sometimes. I mean, like, the ultimate goal would be to be a snowbird, quite frankly.
Yeah.
But because I mean, fall's like my favorite season. Like, I don't know. I don't know if I could stand. I think that it being like living in Los Angeles or something like that. Like, I don't know that I could take that. I would
Yeah.
really need that change.
I need it too, and
Yeah.
Uh, usually right around Halloween, it gets cooler here. So it might get, uh, you know, into the 40s. Like in the winter, we'll get into the 20s or 30s, like
Yeah.
a day or two. But by noon, by 1 o'clock, it's 50 degrees. So like the
Yeah.
mornings will be cold, and so like that's enough change for me.
Hmm.
We don't really have a fall like New England, beautiful fall. Like
Yeah.
no, like the
Hmm.
leaves don't change or anything like that. But um, it's enough that we don't need winter jackets, but we do need sweaters and things, it might snow. It's snowed
Right.
twice since I've been here, but only a dusting and then it's gone, which is
So your
fine by.
kids, do they remember snow from when they were
Oh,
little?
my daughter has nostalgia. Like she just has all of these memories of, I'm like, no, that's not how it went at all. Like it's not.
That's so funny.
She like loves it, wants to go skiing, and my husband grew up in upstate New York, so he grew up skiing.
Yeah.
I was an athlete. I played basketball, and we were not allowed to ski. So it's not
Yeah.
something that was ever a part of my life. I just never was a winter sport person. One of my girls is like, it's too cold. I don't like it. And the other one has all of these like frozen memories of it
Romantic.
being
Yeah.
so wonderful. And I'm like,
It's when you're out there shoveling. We had, as I'm sure you know, and you heard from your family, this
yeah,
past winter, we had an awful lot of snow. And up in Boston, it was far worse than it is here down by the shore in southwestern Connecticut. But like, it was brutal there. We were out there like it felt like every day
Yeah.
shoveling for a while. So
It's funny because I'll get a lot of calls in the winter months from people up north who are looking to relocate down here.
that's so
Sometimes they make
funny.
it. Sometimes they make it and they do it, and sometimes it fizzles out because by like May or June it starts to get a little bit warmer, and then
Yeah.
they're in love with New England again, and then I'll hear from them again in
That's what
January,
happens,
February.
I
Yeah,
think. That's what
yeah,
happens. It's
very
like,
cyclical.
it's nothing like fall. I mean, honestly, there's nothing like summer in Michigan and fall in the Northeast. So, yeah.
I know. We do miss the fall for sure.
Yeah. Yeah.
Football season, that kind of stuff.
Oh, yeah.
But yeah, um, but yeah, we did move because of my health, and that's
That's wild.
That's what it is. It wasn't like I said, I would say it was traumatic
Yeah.
telling everybody we were moving. Um, but
Yeah.
here we are.
Mm-hmm. You're better for it.
Uh,
Yeah.
we are better for it. And I hate to say it. And actually my husband's happier. Like the grind of construction, he worked like in downtown Boston construction, commercial buildings, and the
Yeah.
grind of that
Rough.
was,
Mm-hmm.
and he was working in not great neighborhoods. He was getting guns pulled on him all the time, and like just
Mm-hmm.
he needed to get out of there. He's so much happier here.
Yeah.
Just the pace of life is slower.
Mm-hmm.
So snowbirding, I can see where you would you'd hate Florida because it's summer all year long. It's too hot. North Carolina might be a good fit for you because
Maybe.
they do have more seasonal change there, more
Yeah. Yeah.
colder weather. But
Yeah.
anyways, let's get back to topic here. Um,
What?
I,
What is that? What does that mean?
I don't know. I don't know. Like squirrel, 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 squirrel.
Yeah. No, that's good. Though, what else can I tell you? What else do you want to know?
Well, I'm interested to know what life like after you had your children. You
Mm-hmm.
said you were like in a remission, surgical
Mm-hmm.
remission,
Mhm.
and then you fell out of the remission. Is the word
Yeah.
I'm trying to use. Okay.
Yeah.
So what did that look like when you're dealing with kids? Because now you have kids at this point.
Yeah. Oh, yeah.
Yeah.
Well, it meant, and they were little.
Okay.
It's funny how fast they grow up. And it's weird to say that even just like 10 years ago, yeah, they were little. They were so little. But it meant that I was really pulled out of life. I was really pulled out of everything that I was doing. I freelance, have done so since my son was a year old, and that was unsustainable for me to take a kid to daycare every day. I couldn't do it.
Yeah.
So I went freelance and was lucky enough to be able to do so, and have been able to do so for all this time. But I was like pushing through everything that needed to be done during the day. And then after dinner, like literally taking to my bed, like
Yeah.
some Victorian sick person with a heating pad. And because I didn't know what was happening, we had to go through there was no we, there was just me
Yeah.
and my body,
Yeah.
going through all of the testing to figure out what was going on. Because, of course, when you have ovaries and uterus, they start looking at all of that stuff. And that's the first thing everybody blames it on, even though I had a history of ulcerative colitis. But it turned out that I developed strictures in what's left of my intestines, which means that they are closing up on themselves. So stuff doesn't move as effectively through as it once used to. So that was why I needed to go on treatment again after being in surgical remission and not having to do much of anything for a really long time. But it took a while to figure out what it was. We figured out what it was. And then it took a while because insurance got in the way. So it took a while for me to get treatment. But once I got on treatment, I did improve. The strictures are still there, but they were at least partially inflammatory, which meant that it was like swelling, right?
Yeah.
So getting on a biologic and getting that inflammation under control kind of opened it up a little bit. There's some scar tissue there as well because it was going on and I didn't know it.
Yeah.
So we didn't catch it until it caused me symptoms. And that's where I am today, is that they tell me I am in what they call histologic remission, which is that like test results don't show anything, like there's nothing to speak of. But, at this point though, like I'm also 53. So now like other stuff is happening, you know what I mean? And it's just like, and it happens earlier and sooner, at least it did to me, when you've lived with an inflammatory condition for a long time, So I'm still at the doctor's like constantly and have been through pelvic floor therapy and like, all this other kind of stuff to manage these things. But I'm not gonna complain too much about it. I mean, it's just the reality of it. I'm lucky that I do have insurance. I can go to the doctor. They
Yeah.
do usually figure out what's going on. I am usually able to get treatment and get something going. Yeah. So that's where I am today.
When you said you were like sick and in bed at night, I can relate to that. And I'm sure most
Yeah.
people who are listening to this can relate to that
Hmm.
because that, I mean, I'm not even gonna lie. Last night I went to bed at 7:30 because I'm tired because my meds aren't, I don't have my
Yeah.
meds.
Yeah.
Um, so today you symptom free.
I mean, like, okay, so something that we talk about a lot now with IBD that we didn't talk about in the way back when I was diagnosed because they thought it was basically a condition that affected your intestines, and that's pretty much it, right?
Yeah, yeah,
It affects your whole body. It affects
yeah.
everything. People can
Super.
have complications, skin, eyes, liver, gallbladder, like, you name it. It can urinary tract, like all these things. And I've had a few of those over the years. I think right now the biggest thing is fatigue. And there doesn't seem to be a whole lot out there. I mean, I take vitamin B12 shots. That's something that people who have had surgery on their bowels sometimes need because your body doesn't absorb
Absorb it.
it.
Yeah.
So I do that. They recently told me to increase the vitamin D that I'm taking. So I'm doing that. I go and get my blood work done, et cetera, et cetera. But it's kind of like I don't have the energy of what I think, because I don't know what it is to be a healthy 53-year-old. I only know what
Right.
it's like to be me. But I can look at my peers
Yeah.
and they don't go to bed at 7:30 at night like we do sometimes.
No. Mm-mm.
So,
Or they work out every day. Like
yes.
I mean, sometimes
Yep.
it's hard to look at not. It's hard to not look at your neighbor next door who's
And compare.
the same
Mhm.
age with the same
Mhm.
amount of kids and doing. But that is very much the life that I live right now. It's like,
Mhm.
and the people will invite me to do things, and I'm like, man, I can't go play pickleball, and my wrists don't work. I just, I need my knee does. I need a knee replacement. I need my other knee. Like but I don't lead with I have rheumatoid arthritis either.
Yeah.
Like
Yeah.
it's I've had it for so long that the vast majority of people that live here don't even know I have it because it's just something that I've
Same.
gone through my
Mhm.
life with, and I don't need to explain myself to every single person that comes along. But it is a mind
Yep.
as
It's
to to think about.
yeah.
Um,
I'm
to see
cracking up at the
everybody else
pickleball.
living.
Yeah.
Yeah, I know pickleball. It's such a big thing here. Everybody plays pickleball or mahjong. I don't do mahjong either. Do you play
Mahjong
mahjong?
is having a moment. Like I got
Oh,
up here too.
it is
Yeah.
having a moment. It is having a moment. And I hate board games, so and I tried to play it once. Do you know that that game changes every year? You have to learn all of these tiles and how they work, and then next year they
I
come out with new
did
ones.
not know that. I know that there are people that teach people to play mahjong, and I was kind of like, well, why do you need somebody to
Oh,
teach?
I have a master's degree, and
That's
I was like,
why.
"What is happening here? This is I cannot."
Oh,
It's hard.
that's
But
funny.
yeah, yeah. So mahjong and pickleball, big things here,
Yeah.
and
No
at
pickleball.
least at least with the pickleball, I can say I can't do that. I need a knee
Yeah.
replacement. Mahjong,
Yeah.
I have to make it work. All right, so give me a piece of advice to a young woman, young mom who's newly diagnosed with IBD or ulcerative colitis. That is not how you say that. Ulcerative colitis.
That's
My
hard.
cousin, yeah, my cousin has that, so I know that.
Yeah.
Um, that you would give to them in their early stages of motherhood
Mm.
and disease.
Mm. Take care of yourself. Take care of yourself. You have got to keep that inflammation under control. You've got to. And anybody who tells you to go off your medications, because you're pregnant or because you're thinking about becoming pregnant, that's probably not the answer. So seek out a second opinion. But you definitely need to take care of that IBD. Don't ignore it. Um, the hormone fluctuations that will come along with pregnancy, with birth. with perimenopause can cause you problems. So keep your team close, take care of yourself, and learn everything that you possibly can about your condition. So it's really broad advice, but I think it goes down a lot of little different holes that can
It
cover a
really
lot of
does.
different issues. Yeah.
And I'd piggyback on it a little bit. If you're not comfortable with someone on your team, find somebody you are comfortable with.
100%.
Do not just go along to get along because you don't know and you don't have a voice yet because you're new into this whole thing. And
Mhm.
uh, you got to be
Mhm.
comfortable and you got to trust them and you got to interview them. You pay their bills. Just remember that. That's what I like to
They
say.
work for you. Like,
Exactly.
remember that. They work for you. I mean, everybody
Hmm.
is deserving of respect, okay? But they work for you. And I will say that I think motherhood helps women find their voices
Hmm.
because maybe for the first time you end up advocating for your child. And I think we're all going to advocate harder for our children than we would ever do for ourselves.
1000%.
But once you do it for your child, then I think it also becomes a little bit of a lesson in how that works and how to
Yeah.
do it for
It's like
yourself.
flexing a muscle, like you just you work that muscle out for the first time with your child and now you have a voice. I wish I could go back and do my pregnancies again because I was newly diagnosed and like diagnosed and pregnant within months of each other.
My
And
gosh.
and I was a deer in the headlights and did not ask
Yeah.
questions and just like sat in a hospital bed and labored without absolutely how I would never do it today. Uh,
Mhm.
because you have the perspective with time. And so I think that that's really good advice. Listen to your doctors, but be comfortable with them and ask questions and don't ignore. I ignored for like 5 years. I had so
Yeah.
much damage from that.
Oh.
So much
Yeah.
damage from that because I
Yeah.
thought I knew better. Um, but yeah, that's that's excellent information.
Mhm.
Anything else you'd like to add for our audience? I don't want to keep you too much longer.
I mean, I've done a ton of yapping, so,
I know.
I
This is my favorite way to podcast. I just sit back. Let's let you talk.
yeah, well, we just met recently,
Yes.
so we don't have a deep history of knowing one another's stories yet, and so it's a little bit of getting to know one
Yeah.
another, and I'm sure we're gonna work together many more times over the course of our careers doing this, especially as some of the very small group of women podcasters who are living with immune mediated conditions. So we're gonna circle around each other like all of the time. So yeah,
Love that.
the yapping can go a lot of different places. But I've enjoyed hearing more about you as well.
Thank you.
Since you answered a few of my questions, but can't help myself. Can't help myself.
No,
I'm used to
I
asking the questions. So
yeah, I actually like it. I mean, I would prefer, like I said, I don't love when it's just me on an episode because it's
yeah,
just me talking, but like
yeah.
back and forth, talking to people, learning their stories,
Hmm.
sharing your story is so valuable. There's so many women out there who struggle and don't know where to turn and feel so alone. I felt so alone because when
Yeah.
I was diagnosed 17 years ago, there was no communities for that I was aware of.
Right.
There was
Yeah.
there was groups on
They were
Facebook
harder to find. Yeah.
and they were
Hmm.
harder to find, and it was really misery, sin dipped in misery in a Facebook group. Everybody
Yes.
was so miserable that I had to get out of it because I just was like, this is toxic. And I get it. We're all miserable because we're all in pain. We're all suffering. But that's not how we build each other up either.
Hmm.
So I appreciate what you do. I appreciate your podcast, bringing awareness and advocating for people. That's something that's been on my to-do list for 2026 is to get into advocacy for insurance things and things like that. And it hasn't happened yet, but maybe July's the month.
All right, mama. Like we're gonna talk offline because
Okay.
we could do more stuff, and I have some more ideas for you about
Awesome.
just as we went through discussing how you like to podcast. I got an idea for you. We'll talk about it offline, so nobody,
Excellent.
so that you can surprise folks with it, and just let
Okay.
everybody know I am at About IBD across all social
Yes.
media and on the YouTubes and on the podcast apps, all of them. So you can find me there. If you want to hear, although I don't yap on my own show, it's really just, it's mostly me listening.
Well, you can yap on my show anytime you
I
want.
know, that's what's so funny. So I go
We
on
can
other
be-
people's shows so that I can actually do the yapping.
Yeah, I love it. I love it.
Oh,
Well, you're a gift, and I'm so grateful that our paths crossed. I'll thank Mariah separately because I think she's the one who introduced me to you.
she was
And
Mariah
yeah,
of Mama's Facing Forward, who is an
yes,
amazing resource and one of the most beautiful humans I've ever known in my life, and so driven. So yeah, she's good to
yeah.
know.
So this is a phenomenal group of women that I'm
Yeah,
connecting
yeah.
with my short couple months into this podcasting journey. Before we wrap up today's episode, I just want to say thank you for being here and spending this time with me. If this conversation resonated with you, it would mean so much to me if you'd follow or subscribe to the Autoimmune Mom Podcast wherever you're listening, and take a minute to leave a review. It really helps other moms who are navigating autoimmune disease find this space. And if you know of another mom who might need to hear this message, please share the episode with her. You can also connect with me on Instagram, Facebook, and YouTube at the Autoimmune Mom Podcast, where I share encouragement, resources, and up-to-date updates on new episodes. And don't forget, you can download my free Autoimmune Mom Survival Guide using the link in my bio on my socials. Remember, you're not alone in this journey, and I'll see you next week at the Autoimmune Mom Podcast. Take care of yourself, Mama. Your health matters too.